Wanted to share my story because September is Desmoid Tumor Awareness Month. For those of you who do not know what a desmoid tumor is, it is a extremely rare non-metastasizing soft tissue sarcoma. Only 3 out of every million people get this diagnosis. I was one of the lucky ones when I was 25 years old. I was married, working at a mortgage company. I had 2 kids. I had always been physically active, nothing over the top, just trying to stay in shape. And I started noticing that something was going on in my left limb. My foot would go numb if I walked for very long or if I was exercising, like the circulation was being shut off. When the results came in, his assistant called me with the results, and she told me that it was a typical Baker's cyst and that I should go have a surgeon remove it. At 25 years old, I believed that doctors and nurses knew what they were talking about. I blindly trusted this fact. I soon learned that mistakes can and will be made when you have a rare disease. When I followed up with the orthopedic surgeon, he looked at the MRI and he told me that the report said the area was atypical of a Baker's cyst, meaning that it's the complete opposite of a Baker's cyst. A Baker's cyst and atypical of a Baker's cyst mean the exact opposite in medical terminology. I was immediately annoyed at the misdiagnosis, and then I was scared by his seriousness. What was it? He took me out into the hallway to show me the images. He had one of those backlit screens on the wall, and he put my MRI up there, and he showed me the images, and he said, "This looks like a soft tissue sarcoma." And I remember leaning my head just back against the wall as all of the blood rushed out of my head. I'd never been told anything that scared me quite like that. As I left his office, I gathered myself together because I had another appointment that day. Me and my husband were having a house built, and I needed to pick out flooring. And I remember driving down the street thinking, okay, I've got sarcoma. And I pulled over on the side of the road and I called Tom and I said, I think I might have cancer. And then I went and picked out flooring, like in total shock. A few days later, I had my first oncology visit. The doctor was one of those cocky, know it all type surgeons. He scheduled me for an outpatient surgical biopsy. It was a Friday. He told me that I would be back to work on Monday. That was the final actual work week of my life. He did a biopsy, and then the slides were sent off to 3 different pathologists. They all came to the conclusion that I had a spindle cell sarcoma grade 1. My oncologist had never dealt with this type of tumor before. He was confident that he could remove it without any problems. I was then scheduled for another easy surgery to have the tumor removed. But that's not what happened. He cut my leg open in the popliteal area behind my knee, and he found a tumor that he had never seen before. The tumor encompassed the vein, the artery, and the nerves that run behind your knee joint. It was hard, and all of the vessels were stuck in the middle, and he couldn't remove it. He left the OR and he went to talk to Tom. And he told Tom that they were going to have to amputate my leg. Tom assured him that I would be more than pissed off if they cut off my leg. When I woke up, I found out that this was a much bigger problem than just a little outpatient surgery. My oncologist was pretty insistent that an amputation would be the easiest route. I trusted him, but I was also not ready to just chop off my leg. I was a healthy 25-year-old when I walked in to that appointment, and now I'm being told that I'm going to lose my leg. He did some homework and he found a single case study of a patient in New York that had the same type of tumor that I had in the same location. A single case study. That was the first time that I heard the term desmoid. A vascular surgeon was called in to help with the case. He told me that because I was young and healthy, that there was a chance of saving my leg. He told me that it wouldn't be easy and that the surgery would be extensive, but that it was possible. I chose to fight for my leg. I was admitted into the hospital for what turned out to be a month-long stay. The surgery took 13 hours and 3 surgeons to complete. A tourniquet was used to cut off the blood supply, while a fist-sized tumor was cut out of the popliteal fossa, along with all of the nerves, the artery, and the veins that ran through the tumor. An arterial graft was done by harvesting the saphenous vein from my other leg to put in to where the tumor was. A venous bypass was also done. Finally, they took 5 bundles of nerves out of my left foot and they placed them behind my knee in an attempt at a nerve graft. Does that sound fun? It's awfully fun. When I woke up from the 13-hour surgery, my face was so swollen that my nose and my chin were split open. I thought that this was really embarrassing because I had this weird drug-induced crush on the surgical intern. 2 days later, the vascular grafts failed. My calf swelled up to the point that the muscles were releasing toxins into my system, and I went into kidney and liver failure. I was rushed into emergency surgery where they performed a fasciotomy, slicing the front of my shin open to let the muscle swell outside. They repaired the vascular grafts and they noticed that some of the nerve grafts had also failed, so they attempted to repair them too. Tom hadn't been told very much before they rushed me back into surgery. He spent the night in my hospital room in a terrified panic, thinking that he was going to lose me due to the organ failure. In retrospect, the damage that was caused to the grafts was most likely due to the physical therapist coming in and straightening my leg. They didn't know that it shouldn't be straightened. They were never told. It was not in my chart. We were learning very quickly that we were going to have to educate ourselves and that it's okay to second guess the medical professionals. 25 days after what was supposed to be a simple outpatient surgery, my incisions were finally stapled up and I was released from the hospital. The house that me and Tom had built was finally finished. Tom and the kids had moved in, but I needed 24-hour care. Tom had to work full-time to support the family and to take care of our 2 kids. My daughter was 4 and my son was only a year old. We all decided that I should stay at my parents' for a while until I was a bit stronger. Tom's mom had taken care of the kids while I was in the hospital, and she would continue to take care of them while Tom was at work. I missed my kids tons. I'd only seen them once when I was in the hospital. And on that day, my son was so scared of me because I had all these tubes and things sticking out of me. Not seeing my kids was just as hard as the infection that was now starting to take over my body. The skin around the staples started sloughing away, leaving the staples to fall out. I started running a temperature and my wounds actually started to smell. I had only been out of the hospital for a few days, but now we were heading back. My wounds were not healing. They were actually getting bigger and deeper because of the infection. This was when I learned all about open wound debridement. Without anesthesia or anything to help with the pain, I laid on the table holding my mom's hand while my doctor cut chunks of dead skin and muscle and tissue out of my open wounds. I had a large open wound on my shin from the fasciotomy. I had another open wound behind my knee where the tumor had been. And I had incisions running down the back of my leg all the way to my foot. I also had an incision on the opposite leg on my thigh where they had taken the graft for the vein for the graft. Some of the wounds were healing like they should be, but the two main wounds were disgustingly open. Debridement is not for the faint of heart. And I have to say that out of all of the struggles that this disease has given me, that debridement was by far the most physically traumatizing. The mental trauma of this disease is a whole different part of the story. The medical team decided that the wounds would need to remain open to heal. I started having appointments twice a week for debridement procedures, and I had home nurses that started coming to the house 3 times a day for wound care. With the home nurses coming in to help, I finally got to move into my own house. We had a small bed put into the living room, and that's pretty much where I stayed for 6 months. My kids learned to be compassionate and kind. They loved the home nurses and they became decent little nurses themselves. Tom learned how to pack wounds, and he actually got better than the nurses. I continued to have problems with infections, ending up on IV antibiotics. So Tom also learned how to flush my IV line and change the IV bags. He did this at all hours of the night. The poor guy was going to work all day long. Then he would grab the kids from his mom's, bring them home, give them baths, put them to bed, and then he would play nurse all night long. We were so young, and we were just starting out our lives. The two incomes that we had became one, and we started digging this big financial hole with medical debt. That financial hole haunted us for more than the next decade. For 6 months, debriding and home nurses continued. I couldn't feel or move anything below my knee except for nerve pain. The nerves that had been transplanted were trying to communicate, which causes pain. It feels like being stabbed. It's like this constant stabbing in random places throughout my leg. It was bad enough that it made my face twitch with pain, and concentration was nearly impossible. 28 years later, I still get stabbing pains from the nerve transplants. My leg is still paralyzed from surgery, and there is still no movement and no feeling. I developed foot drop that we needed to fix with a brace. But because I had no feeling in the foot, the brace caused a pressure sore, which of course got infected. The infection worked its way into the bone, so another surgery was scheduled to remove my ankle bone and to fuse my ankle. I was actually excited for this surgery because I had been on crutches for 6 months, and I was just excited to be able to try to walk. On the morning of the surgery, I was prepped, I was ready, I had the IV in, I had the cute little hat on, and the surgeon walks in and he tells me that we have to postpone because the routine pregnancy test came back positive. Swear that was an accident. Me and Tom had always planned on having 3 kids. We even planned that they would be a girl and a boy and a girl. I had my daughter and I had my son, but I had been so sick that we decided that we shouldn't have any more kids. We had already discussed a vasectomy for him, but obviously we hadn't followed through with that yet. The news that I was pregnant hit me hard. I was on morphine along with a slew of other pain medications. I was too skinny at 115 pounds. I was throwing up every day trying to go through morphine withdrawals. I hadn't been able to walk for over 6 months. I had an IV port hanging out of my neck, and my mother-in-law had been taking care of my two kids. I was told that the hormones from the pregnancy could make my health even worse and possibly cause the amputation that I had been trying to avoid. The doctor told me that an abortion should be considered, and I was sent home extremely confused and extremely sad. The decision that I had to make was a heavy decision. If I went through with the pregnancy without having a surgery, I would have 8 more sickly months on crutches and then have an infant that I wasn't able to take care of. There was also the possibility of the hormones causing additional tumors. I had always wanted 3 children, but I also knew that I was not healthy enough to take care of another one. My next appointment would be with a perinatologist to check on the health of the baby. With the drugs that I had been on, there was a good chance that the baby's heart or mouth formation could be affected. A very detailed ultrasound was done, and I was told that I was about 6 weeks pregnant, but the baby was healthy. I decided that I would go ahead with the surgery, and even if I lost the baby during surgery, then that was how it was meant to be. I didn't want the burden or the guilt of making that decision on my own, so I let fate decide. The ankle fusion was the first success that I had had for quite a while. After some recovering, I started physical therapy. Because of the massive amount of nerve damage that was done behind my knee, it no longer correctly functioned. It was locked at a 45-degree angle. I couldn't straighten my knee. I couldn't bend my knee. And I could walk with crutches, but only on like the tip of my toe. At this point, things really weren't too bad. We were getting adjusted to our new house. I no longer had a constant barrage of nurses coming in and out, and the pregnancy was going surprisingly fine. Mentally, I really never accepted that I was pregnant. I never told anyone about it. If anybody knew that I was pregnant, it was because somebody else told them, my parents or Tom, somebody had told them that I was pregnant. I was doing everything that I was supposed to do to try to get better as best I could. But I knew that I was very fragile. I was extremely fragile mentally and physically. I was now on lifelong anticoagulants. So I was giving myself heparin shots in my little pregnant hard belly. Sometimes Tom would give them to me. Sometimes my daughter would do it. She actually liked doing it. She pretended like she was a little nurse. When my daughter started kindergarten, on her very first day, nobody went with her. Nobody picked her up from school. I also never went on any school field trips with her. Even though there is nothing that I can do to change that situation, I still personally have a ton of guilt about that. My youngest daughter was born a beautiful, healthy 6 pounds, 9 ounces. My weight at delivery was an unhealthy 135. She was by far my easiest baby. She was happy to just hang out in her high chair, play on the floor. She would sit in her swing for hours at a time. She was even happy in the mornings, like when she woke up in the morning in her crib. I could just hear her playing with the little toys in there. She didn't cry. She didn't scream for me. I couldn't carry her around very well, and I couldn't get her in and out of her crib. But I had 2 other extremely awesome kids that would help out anytime I needed help. Somewhere along the way, I became aware that these kids were the children that I was always meant to have. I had always wanted three. I wanted a girl and a boy and a girl, and that's exactly what I had. I believe that my youngest daughter had been in heaven looking down at our family, knowing that that was supposed to be her family. She could see that we were struggling, and she knew that there was a chance that she wouldn't be able to come. She decided that even if the timing totally sucked, that she had better be on her way, even if it caused us some stress. I believe that she was my angel in heaven looking down on me when I was at my sickest point. As a baby, she was so easy. And as she grew up, she knew somewhere inside of her that she is my angel. When I am sick, when I am sick or emotional, she knows. When I have random nerve pain and no one else notices, she's the one who notices. And she's the one who asks me if I'm okay. Out of all of the things that this disease has taken away from me, I will forever be grateful for the things that it has given to my children. They didn't have the same experiences as other kids, and it made them better, more compassionate adults. They are empathetic, kind, and understanding. I spent the next few years trying to get my life back. I wore one of those walking boots for a long time. I did yard work for the new house in it. I went trick-or-treating in it. I even drove a stick shift car with it because I couldn't get out of my lease. I'm not sure if I've always been stubborn, but I know I became stubborn. I am not going to let this dead leg stop me from doing the things that I want to do. I started hauling my kids with me to physical therapy 3 times a week. They loved it. Not sure if the staff loved it, but the kids loved it. I had a physical therapist that was willing to think outside of the box. My knee was still stuck at a 45-degree angle, and we needed to get it straight so that I could walk. My physical therapist had me start using a ratchet strap and a 2x4. So in the evenings when it was time to watch TV, I would take the ratchet strap and I would strap my leg down to the 2x4 to put it into a straight position. It was painful, and I would just hang out as long as I could stand it. And then I would release it, and then I would tighten it back down again. It worked. We finally got mobility back in my knee. With my therapist's help, I learned to walk with a minimal limp that most people don't notice. For a while, I got yearly MRIs to follow up on the possibility of a recurrence. Then I stopped. We had already dug a huge financial hole with medical bills, and I had a life to live and a cute little family to raise. It took me almost 14 years after my original diagnosis to become worried again. My left leg had not looked good since the original surgery, but it started looking worse. Without any feeling, I always gauge how my leg is doing by the way it looks, and it was looking dead. I complained to my family doctor about something being wrong with my leg for a full year before I was able to get a referral back to my vascular surgeon. At my vascular appointment, they tried to follow the blood supply from my knee to my foot with ultrasound. They couldn't. The blood supply was not visible on the ultrasound in 2 places. They had found 2 new masses in my leg. Without an MRI, we couldn't be sure what they were. So I was sent back to my original oncologist who ordered an MRI. And my oncologist called me with the results of that MRI. He told me that it was finally time for the amputation that we had talked about all of those years ago. And he confirmed that I had 2 recurrent tumors. He also told me that he was retiring and he would refer me to a different oncologist. I have to tell you, as a rare disease patient, when a physician leaves your medical team, it is crushing. You build a relationship with these people, you learn to trust them, and then they're gone. When you have to start over with someone new, it totally sucks. In 2011, I was started on tamoxifen along with Solindac. The combination of these medications gave me immediate stability, and I could actually feel that the tumors were getting softer. I stayed on these medications for 5 years and the tumors remained stable. The meds came with side effects that I thought were tolerable, and at the time I was pretty happy with the outcome. I had been alone with this disease for 15 years and had never talked to another desmoid patient. The internet had advanced, so I started looking for people like me online. These patients had never talked to another desmoid patient either, so it was extremely exciting for all of us. Finding these other patients opened a floodgate of friends that understood me. This group gave me a new drive and a new purpose. I didn't want anyone to ever feel alone like I had felt. I started to actively search for patients online to invite them to our little family. When the Facebook group, The Desmoidian, was started, we had less than 100 members, but these members were more educated about desmoids than any of our individual doctors. Our doctors at the time really didn't have any resources to pull from. The information and support that we began to share was invaluable to us, and we were no longer alone. I'm not sure how to end this video because it's a heavy topic and it was very long. My journey has been long. I am still paralyzed from the knee down. I have no feeling and no movement in that part of my leg. I still get nerve pain occasionally. It's not debilitating like it once was, but it's there sometimes. The medications that I have been on have caused some bone density problems, so I am aging a little differently than I should be. And I do have chronic pain. But I have to say, I can hike, I can bike, I kayak. I am actively in a band with my husband that we absolutely love. I lead a very active lifestyle and I am enjoying life to the fullest. And one of the reasons I can do this is because of the other patients that I have been in community with. We support each other, we love each other, and we make sure that nobody ever feels alone or isolated. And that is my goal in the Facebook group. And it is my goal in this video is to make sure that nobody ever feels alone. So with that, just want to say, I love you.